Diabetes by Health and Fitness. Please subscribe this channel and don't forget to press bell icon to remain update regarding to health and fitness, and must share with your loved one.
Let me explain what is diabetes. Diabetes is a chronic condition characterized by high levels of sugar, glucose, in the blood. The two main types of diabetes are type 1 and type 2. In type 1 diabetes, the body does not produce insulin, which is needed to regulate blood sugar levels. In type 2 diabetes, the body does not produce enough insulin, or the cells in the body do not respond properly to insulin. Symptoms of diabetes include increased thirst and urination, fatigue, weight loss. Let me explain about diabetes symptoms.
The symptoms of diabetes can vary depending on the type and severity of the condition. However, some common symptoms of diabetes include increased thirst and frequent urination, fatigue, blurred vision, slow healing of cuts and wounds, tingling or numbness in the hands and feet, unintended weight loss, hunger, dry and itchy skin, yeast infections, especially in women, irritability and mood swings, nausea and vomiting. In type 1 diabetes, darkened skin in the armpits and neck. In type 2 diabetes, it's important to note that some people with type 2 diabetes may not experience symptoms in the early stages of the disease. Therefore, regular checkups and blood tests are important for early diagnosis and treatment. Diabetes side effects. Diabetes can lead to a number of serious health complications if left untreated or not well managed. Some of the potential side effects of diabetes include cardiovascular disease. People with diabetes have a higher risk of developing heart disease and stroke. Nerve damage, neuropathy. Diabetes can damage the nerves in the body, leading to pain, numbness, and tingling in the hands and feet. Kidney damage, nephropathy. Diabetes can damage the kidneys, leading to kidney failure and the need for dialysis or a transplant. Eye damage, retinopathy. Diabetes can damage the blood vessels in the eyes, leading to blindness. Foot damage. Diabetes can damage the blood vessels and nerves in the feet, increasing the risk of foot sores and amputation. Skin problems. Diabetes can cause dry, itchy skin and an increased risk of skin infections. Dental problems. Diabetes can increase the risk of gum disease and tooth loss. Sexual dysfunction. Diabetes can cause erectile dysfunction in men and vaginal dryness in women. Cognitive decline and dementia. People with diabetes are at a higher risk for cognitive decline and dementia. Depression and anxiety. People with diabetes are at a higher risk for depression and anxiety. It's important to work closely with a healthcare provider to manage diabetes and monitor for any potential complications.
Diabetes safety. There are several steps you can take to help ensure the safety of people with diabetes. Regular monitoring of blood sugar levels. People with diabetes should regularly check their blood sugar levels to ensure they are within a safe range and make adjustments to their treatment plan if necessary. Adhering to a healthy diet and exercise routine. A healthy diet and regular physical activity can help keep blood sugar levels in check and prevent complications. Taking medications as prescribed. People with diabetes should take their medications as prescribed and keep their healthcare provider informed of any changes in their condition or side effects they may be experiencing. Wearing a medical ID. People with diabetes should wear a medical ID that indicates they have diabetes in case of an emergency. Regular checkups. People with diabetes should schedule regular checkups with their healthcare provider to monitor for any potential complications and to make adjustments to their treatment plan if necessary. Learn how to manage low blood sugar, hyperglycemia, and high blood sugar, hyperglycemia, and how to recognize the symptoms. Have a plan for managing diabetes during pregnancy if applicable. Prepare for emergencies. People with diabetes should prepare for emergencies by keeping a supply of insulin and other medications on hand, as well as a source of quick-acting sugar such as glucose tablets. It is important for people with diabetes to work closely with their healthcare provider to develop a safe and effective treatment plan that fits their individual needs.
Diabetes treatment. Treatment for diabetes depends on the type of diabetes and the individual's specific needs and health status. However, Some common treatments for diabetes include lifestyle changes, maintaining a healthy diet, regular physical activity and maintaining a healthy weight are crucial in managing diabetes. Medications. Depending on the type of diabetes, different medications may be prescribed to help control blood sugar levels. These include oral medications such as metformin and sulfonylureas, as well as injectable medications such as GLP-1 receptor agonists and SGLT2 inhibitors. Insulin therapy. People with type 1 diabetes and some people with type 2 diabetes may require insulin therapy to regulate their blood sugar levels. Insulin can be administered via injections or an insulin pump. Monitoring. Regular monitoring of blood sugar levels is important in managing diabetes. This may include daily self-monitoring or regular visits to a healthcare provider for blood tests. Foot care. People with diabetes are at a higher risk for foot problems, so regular foot exams and proper foot care are important in preventing complications. Education and support. People with diabetes may benefit from diabetes education classes and support groups to learn more about managing their condition. It is important to work closely with a healthcare provider to develop an individualized treatment plan that best suits the patient's needs and goals.
Thanks for watching. Please subscribe my channel and don't forget to press bell icon to remain update.